In this presentation, we're going to talk about oral health strategies for dental decay. And we're going to be following the CAMBRA protocol. This is dental decay management by risk assessment. And basically what this does is it kind of creates a system and it kind of simplifies things for the dentist as far as what the protocol is. What do you do for what patient? When we talk about personalized dental care, we're talking about individualized care where people get different care depending on how they present. And so in CAMBRA, what we're looking at are risk factors and protective factors. And one of the symbols for CAMBRA is this balance scale, because basically what we're talking about is an oral environment that's in balance. And so the risk factors are the real obvious ones: diet, dental hygiene, how well you take care of your teeth, bacterial load, and that would include immunity, oral pH and the quality of your saliva, and also there's a genetic component. The protective factors would include fluoride in any form, in the water supply, in your toothpaste, mouth rinse, or in a varnish that can be applied in the dental office. Dental sealants can also be applied to smooth out the deep cracks and the deep crevices in the teeth and make it less susceptible for collecting biofilm. Sometimes an antimicrobial rinse that kills bacteria. Xylitol is very effective in addressing dental decay issues. And remineralization therapy. These would be a toothpaste that has added calcium and phosphate to help remineralize the enamel surface. In the background here, you see a pan balance, and this is something that I made up for the Learning Lab to help young people understand about this whole idea of balance. So on the one side it's risk and one side's protection, and in this case the risk factors are over here a little bit higher. This may illustrate xylitol gum, so if you drink a soft drink you may want to follow that up with some xylitol gum and to bring the balance back into proportion. That's the illustration that we want to teach in CAMBRA so that young people better understand that they have control of this process. So in all of these protocols, we want to work with your primary care physician, especially if there's a significant decay issue, and let them know what treatment that we're initiating and what our objectives are. In the diagnostic objectives, we're going to review medical history, family history, look at your overall dental health condition, and screen for the decay-causing bacteria, and also the potential for the salivary issues. The Carry screen is a meter that's used. It's a very, very simple salivary test that helps measure the level of strep mutans specifically in the mouth. And we get an actual reading, and it's a device that's used to help in the risk assessment. Sometimes we may incorporate a salivary buffer test because saliva, the consistency of your saliva, is very, very important when we're looking at decay rates. And this is a very simple test that we can measure how much saliva you're producing over a period of time. X-rays, digital X-rays are most prominent today in most dental offices, and also laser diagnostics. There's a tiny little instrument. There's a couple of different kinds that can actually be placed on the tooth and to assess the level of decay. So treatment requires a personalized approach because not everyone presents the same, and it's based on your current condition and your overall health. And so we're going to talk about this whole concept of balance between the pH and your bacterial environment. So we will probably start with some type of an oral disinfection protocol, and we have therapeutic targets. And what we mean by targets is if we know that you have a specific level of bacteria, we want a reduction in that level of bacteria, and we will place you on this regimen until we hit those targets. So basically the treatment is very straightforward in that it includes product recommendations, and we select a proper interval to support your home care, because really the patient is responsible ultimately for supporting this at home. We will select the products for you to use and determine if you're being successful in supporting things at home. So the product selection can be an antibacterial, pH neutralizer, a remineralization product, a desensitizer, and a product specifically for dry mouth. Home care, like I said, is the most important component of this. We're going to train you in daily biofilm control and pH neutralization, the possibility of xylitol products, either with gum or some xylitol product, antimicrobial rinses, and also the use of the floss pick and oral irrigation. As you may know, I'm not a big fan of dental floss because compliance is an issue. And it's not as effective as an interdental brush, which goes in between the teeth. This is an example of some of the various home care products that we might recommend depending on how you present. And then the recare visit is really, it varies depending on how the patient is doing. And the better that you do, the longer the interval between your treatment times. So regular recare visits to the dental hygienist are essential. We monitor and modulate treatment according to how you present. And we monitor your oral bacteria on an ongoing basis.